Hi, I'm Dr. Anstey. Today I want to share with you a big issue that I see all the time, a massive problem that I'm observing in that relates to dental implant surgery. And so the problem is that dental implants are in fashion and teeth are getting extracted across the board. And in this particular case, the extraction was unavoidable. The patient in her 20s fainted, she broke the tooth, and there's no other option when you fracture a tooth down the root. Unfortunately, you've got to remove it. The next best thing to do is to place a dental implant. But what's critical and what was missed in this case is that the implant was not placed in the correct position. So the general dentist who placed this implant did not bother to plan the case correctly. He didn't take a CT scan, okay? So lesson 101, you need a CT scan because you cannot look at x-rays. You don't know. That's a two-dimensional image. You don't know what the site where the implant's got to go is going to look like in 3 dimensions. This is no different to construction of a home. You need to know what the soil looks like, what the bedrock quality is, so that when the engineer places the caisson, in this case it's a dental implant, you need to know if that caisson is going to be holding up in bedrock, if you're in soft sand, what the quality of that bedrock is, how thick it is, how deep it goes, etc. Well, it's very, very basic in my mind that in order to do this for dental implant surgery, you need a CT scan. And unfortunately out there, there's abuse. Dental implants are being placed with no regard for taking a CT scan. This is a case, if you look at the screen right now, where no CT scan was taken. As a result, when the patient arrived in my office a year after implant placement, you can see the extremely red gum tissue, very inflamed, due to the underlying infection. When I pushed on the tissue, you can see this bolus of pus that we are extruding along the implant surface. And so there is infection that you cannot see. Now, when the patient smiles or is going about her daily business, she has no idea this is happening. Can you imagine? She's living with an infection in her jaw, a failing implant, and bacteria that can now seed from the jaw, from the tissue, the gum tissue, through the bloodstream into her body and can migrate to other systems inside her body. There's a lot of scientific literature that relates and speaks about this. So she could have systemic manifestations of bacteria and has no clue about it, besides the fact she's got this horrible failing scenario in her mouth. Failing implant, pus, and ultimately a disaster. And so if you look at the image on the left, this is a rendition from the CT scan for explanatory purposes only in this video that is showing you the implant surface that has no bone around it. It's supposed to be housed in bone 360 degrees. There's no bone, and because of this, bacteria are able to colonize this implant surface and basically live inside her body. So she's walking around with an infection, asymptomatic, has no idea. So what we do in this kind of case, and in fact in every single case, is before we place the dental implant, we take a CT scan. And I can strip back the CT scan so that I'm just left with the upper jawbone. Now here we are with the upper jaw showing the teeth, and the lab has done what we call a virtual wax up. They've placed a tooth here in position. And the reason is, when I do my implant planning, I'm able to then go ahead and work out exactly where the implant needs to be placed. So I can measure the thickness of the bone, I can measure from the sinus, the height of the bone, and that allows me to then go ahead and pick the exact size implant. So I've already done this to shorten the video. We know exactly the size of the implant that's going to be placed. For purposes of explaining this, I'm going to go ahead here and remove the cylinder. I do not want to show the cylinder. It's at 0. Let's take it away. And then there's the dental implant. So as I'm explaining, the lab does what we call a virtual wax up, where they place a virtual tooth that allows me to plan and know exactly where the tooth needs to end up. Because remember, we're placing the implant so that ultimately it goes straight through the center of the tooth. So if we go back to the image on the upper left, you can see as I tilt up, that dental implant is going to be coming directly through the middle of the tooth, because when you restore it, you need it. It can't be off angle. You can't have it coming off at a weird angle such as this. I mean, that just wouldn't be restoratively viable. So we can plan it exactly now. Not only that, but the implant planning software, this guided implant software, allows me to see exactly where the bone is. We built this bone, so I measure this. I know I've got more than 2 millimeters of bone, but I also see that there's a slight deficit on the inside. So it allows me to pre-plan, no surprises when I go into surgery. I'm already warning the patient we might need to add a little bit of bone on the inside in this particular case. So this virtual planning software is phenomenal because it allows me to basically plan the implant surgery ahead of time. It allows me to then be able to do what I call a virtual surgery. In other words, I'm doing the surgery before the patient's in the chair through a computer guided system on the computer screen. And then from the software, we then email the data set to a lab, which then goes ahead and manufactures a surgical guide and a surgical guide model. So then what happens during the surgery with this 3D printed model and 3D printed guide is that I know exactly through this little gold hole here on the implant, on the surgical guide, I know exactly where the position of that implant is, not only in this dimension, but in 3 dimensions. We have tools that fit in there. When we're placing the dental implant, the implant is going to be guided and the drilling set's going to be guided in the exact dimensions as we planned it on the software that I just explained. So it's an incredible technology, this implant guided software that we use. It's a CAD/CAM type of technology, and that allows us to perform what we call implant guided surgery and avoiding anatomical structures such as nerves and blood vessels and the sinus on the upper jaw in this particular case. And even when we need to do, when the implant does invade the sinus space, we're able then to actually plan the implant surgeries with the sinus lift so that ahead of time we know exactly how many millimeters we're going into the sinus. I mean, it's just an incredible technology. It allows us to work with precision. It's really hard to believe, and I see it in this practice where implants are placed angled in the wrong position. Implants are placed hitting up against adjacent roots. I've had to do root canals on teeth that shouldn't have needed the root canal only because the surgeon placed the implant at the wrong angle and it basically hit the root of the tooth next door. I've dealt with cases where I've seen implants in the nerve canal, patients ending up with a numb lip that basically it's damaged for the rest of their life. So many issues that I've seen. You know, it's simple. Do it right. Use implant guided software. Use cutting edge techniques and the software. And then you end up with Class A results. I mean, then you end up with results where you're doing the best possible thing for a human being. You are treating patients with the respect they deserve. You're giving them the best that is possible. Not only that, you're avoiding any kind of risks or dramatically reducing the risks. And, you know, there's really no other way. I mean, this is the way to do it. I'm sensitized. I spent about 70% of my time in this practice fixing mistakes. 70% of my time fixing mistakes, mainly relating to root canal mistreatment or dental implant mistreatment. And this is one case in the dental implant arena that, you know, is more common than you would believe. One of the issues is that most of these things occur with a patient that is walking around that has no symptoms whatsoever, is pretty much unaware that they have a problem. In the meantime, they have pus, they have inflamed red gums, they have bacteria filtering through not only the oral cavity and the jaw, but entering into their bloodstream and having the ability, these bacteria and viruses, of seeding anywhere else in their body and creating a problem which ultimately could cause severe sickness, organ shutdown, and death. It sounds dramatic, but the long-term implications of this are in the scientific literature. You can go read them yourself, and this data is still unfolding. So I'm very well aware of what is in the literature right now. There's more to come, but I think it's time to start dealing with patients in dentistry and the oral cavity with much better understanding and a biologic type of approach, what I call biologic thinking, which is missing for the most part, so that dentistry can raise itself up to another level, to a higher level of treatment, and that specialists are doing specialty procedures and generalists are doing general procedures. That's really where we need to get back to. Bottom line, end of story. Thank you for listening.